Hello and welcome. You are listening to Functional Wellness with Dr. Alison, and today we are talking about vaginismus, painful sex, maybe you have low libido, and if you're struggling with any of these issues and you're told that you just need to relax, maybe drink a glass of wine and take a Tylenol and just grit your way through your relationships and your intimate time, and there's no options. I am here to help you start to navigate why you're having these issues, what to test for, what to ask your doctors for, how to get help, some things that you can do at home and get you back to a place where you feel good in your body, your hormones are balanced, you have an excellent libido, you enjoy sex, pain is not even anything that you have to worry about anymore. Wouldn't that be wonderful? And it's possible. I've worked with so many women who have issues with pain during sex and even can't wear a tampon or use a diva cup or anything like that. So we're going to help you navigate and get some ideas on how to get some help. So the obvious place we'd start with is actually hormones, right? Because we can have a poor balance of estrogen and progesterone. Testosterone can be either high or low. I've seen it go both ways, honestly. And then many times it's the hormone DHEA. So we really do need to do a good test for you if you're struggling with any hormone imbalances. I would recommend saliva or the Dutch urine test. So that way we can get really specific and see exactly what's going on in your cycle. And we get to see a broader effect of more hormones as well and see what's going on there. Now, of course, stress plays a role because cortisol plays a role. And what cortisol does is it steals essentially other hormones so we can create more cortisol. Some people refer to it as pregnenolone steal, and it's a term that you might commonly hear with adrenal fatigue or fibromyalgia. So what happens is that our body increases cortisol. Cortisol actually pools in the pelvic floor, so it's often linked to swelling, pain, vaginismus, and hemorrhoids that are not manageable or not reducing with any type of treatment. And that's also why I love doing a saliva test or a touch test, because we can track your cortisol throughout the day, make sure that it's high in the morning so you wake up with energy. It comes down during the day so it's low at night. I've seen people all over the charts, and what's fun is that I had someone just do a saliva test, and I said, "Look how low your cortisol is in the morning. It should be high." And she said, "Oh my goodness, I thought cortisol was always supposed to be low, and everyone keeps telling me you got to lower your cortisol, you got to lower your cortisol." And the truth is, our cortisol just needs to be balanced. It should change throughout the day. It's part of our daily circadian rhythm. So getting testing is really important. Instead of just blaming cortisol, we can find something else that's actually that root cause. Now, low estrogen is the most common cause of vaginismus, painful sex, any pelvic floor issues, dryness, things like that. So getting a cream, like I like to use Goggin, they have amazing hormone support, can radically change the tone of your pelvic floor, allowing it to relax and then tighten as it needs to be. And then honestly, the most important thing you can do is get to see a pelvic floor physical therapist. And if you need a referral or a recommendation, please reach out to me. We can find someone in your area. PT can drastically change your life. It absolutely will. They are wonderful for helping navigate pain management, making sure that your muscles are working correctly. And what PT, especially pelvic floor, teaches is that we need a balanced pelvic floor. It's not that you need to strengthen most of the time. I would say 90% of the time, women need to learn to relax their pelvic floor, because that tightness leads to leakage, stress incontinence when you cough, sneeze, or you get on a trampoline and you need to change your pants. Pain with sex is often related to your pelvic floor being too tight. And what they can do is to use biofeedback to see where your muscles actually are. They can do internal work to relax those trigger points inside your vaginal canal. And that's also something that I recommend for women who are pregnant and looking to have a vaginal birth, and doing that type of muscle work can help relax and reduce pain during birth, improve pushing times, all of those good things. And then, of course, therapy, because we need to feel good in our body, comfortable and confident, and allowing ourselves to relax into ourselves and what we want and feeling good will help reduce pain. Not the only thing, right? There's a lot of things we got to talk about. And then I also like to add on my physical list of things to do is true self-care, which includes eating food throughout the day, not skipping meals, working out, or at least moving, getting good sleep, going to therapy, doing mirror work, things that boost your self-esteem but also support your body. Now, nutritionally, there are a couple things that we can do. I was Googling, of course, as I was setting up this conversation for my free Simplify Your Cycles program, which is still running. I'll drop the link in the description for you. And I kept coming across, foods that'll reduce vaginismus, foods that'll reduce pain. And the reality is that food itself is probably not the cure when you're in this situation. And many other situations, honestly. And I keep saying this for Epstein-Barr. Just eat a kiwi to cure your Epstein-Barr. It's like, oh my gosh, no, that's not how this works. But food can help balance your hormones. Food over time can reduce inflammation and pain. So I'm going to go through my top 4 things that I have for you nutritionally. Now, greens and fiber. So I always get doTERRA greens and doTERRA's fiber because that reduces high levels of estrogen, but also balances them out. It supports liver pathways for your hormones as well as the fiber does. And because our liver transforms our hormones, puts it into our gallbladder to be released through the gut, we need to have a healthy liver, healthy gallbladder, and healthy gut for good hormone balance. The next thing I recommend is either 2 diets. I love the low oxalate diet for women who struggle with pelvic pain. When we take in oxalates, it's like needles into our tissues, especially our joints, our gut, and the pelvic floor. So doing a low oxalate diet, which often happens to be the carnivore diet, has helped a lot of women reduce vaginal pain. Other women have really good success with AIP, the autoimmune protocol for lowering inflammation, and that type of meal plan. So really it depends on you, your immune system, the food sensitivities that you already have, and figuring out what would be the best program for you. And that's why I love digging in with my patients. And I always have everyone track their foods, whether they send me an Excel sheet or we use something like MyFitnessPal, because we can really hone in, and sometimes it helps someone else looking at those foods and be like, hey, you've been eating a ton of spinach and kale. I need you to cut that out for 2 weeks and see how your joints feel. And sometimes that makes that really big difference because we don't see the foods that we're eating on a consistent basis and how they might be impacting our body. And then the other thing nutritionally are B complexes. B complexes, all of them, not just B12, not just B6, are radically important for tissue health, tissue energy, cervical health, and reducing inflammation, especially if you are on birth control. So like we talked about in a couple episodes ago about birth control, it does leach nutrition out of your body. And if you don't have those nutritive factors, you are putting yourself at risk for cervical cancer. So if you're on birth control or you have a history of using birth control, you have to be taking B complex. And again, I recommend Patch MD for getting your B nutrition patch. You just have to put one on your skin per day, and then you don't even have to take any pills. Wonderful. Okay. The other thing I love to use, of course, is Chaste and progesterone. And we already talked about the Osteoderm cream from Goggin. Now, I would not say that every woman needs to go out and take Chaste and make sure that they're getting progesterone in or a specific type of estrogen, because you need to make sure your hormones you need to find out where they are to start. I see a lot of women come in, they're like, oh, Alison, my libido is so low and I feel so tired and it's got to be my testosterone. I bet it's so low and I need to have my hormones done. And then it comes back and their testosterone's just fine. It was something else. So if they had gone out and taken either testosterone shots or pellets or things that improve testosterone, it might have messed up their other hormones. They'd probably be more angry and irritable and wondering why they're freaking out because they took the wrong supplement for the wrong issue. So make sure you get your testing done. Make sure you get that personalized care and make sure you take care of yourself. So you have to look at this nutritionally, physically, you got to look at it emotionally, spiritually, how is your relationships doing, get your PT done, your own therapy, couples therapy, sex training. You need to research and educate and do all the things you can do to take care of you because that's what's you're most important. And this is drastically going to either affect your life in a positive way or a negative way. And you deserve a pain-free life. Okay. So the last things I want to touch on, because this is just, it's just so important, is that use lube and be careful that it doesn't affect your condoms because you don't want any breakage if you use condoms. Women need about 20 minutes of foreplay to be ready. So if your sexy time is lasting less than 10 minutes, that's probably part of the problem. You need to focus on pelvic floor breathing. So your pelvic floor, it matches your lung diaphragm. So when you breathe in, your lung diaphragm goes down, your pelvic floor relaxes. And when you breathe out, your diaphragm contracts to get the air out of your lungs, and your pelvic floor comes up and contracts. Now, they're barely perceptible, but this is a great place to start just focusing in on breathing and contracting and feeling into your pelvic floor movement. Don't feel like you have to constantly suck in and tighten everything up. That's going to lead to more pain and more inflammation. So allow yourself to relax and get that motion synced up. And adjusting goals during sex would be the last one we can touch on. When you're going through these programs and you're taking care of yourself, you will need to adjust how you view sex, how you view completion, how you view foreplay, and work with yourself and your partner on setting different goals and different ways to connect with each other that reduce pain, reduce pressure to just say, okay, well, penetration isn't the goal because we need to support your tissues while you're going through this. What else can you do? And it's a great time to become creative and really work with each other to help your body feel good, but still experience connection. Okay. Thank you so much for tuning in. Really appreciate it that you're here today. So make sure you like and subscribe so you stay tuned with all of our weekly podcasts. And as always, if you need personalized care, don't hesitate to reach out, schedule your appointment online, and we will get you taken care of, get the testing that you need for you done, make sure you're doing the right foods and the right supplements so you can stop guessing. And make sure to check out my free program called Simplify Your Cycles. All the videos are going to remain up. And when you sign up with the program, even if it's after February, you'll get an email with the links to everything. So it's all in one place for you. All right. Thanks for tuning in, and we'll see you next time. Thank you for listening to Functional Wellness with Dr. Alison. If you would like personalized care and testing, you can schedule an initial consult online and get started with your wellness plan right away, or message us on Facebook at Little Black Bag Medicine. Thanks for tuning in, and see you next week.